On today's episode of the Cruz Orthodontics podcast, Dr. Cruz has explained to us why every smile is unique and how he treats every patient individually. Dr. Cruz, what does personalized orthodontic care mean to you?
First and foremost, I think it starts with listening to the patient. You cannot create a custom kind of personalized treatment plan if you don't take in the feedback that the patient is providing to you. And there are a couple different ways that you can look at it. I think that one of the ways that you can look at personalized care is kind of factoring the means in which you're going to be providing the treatment. Is it going to be with clear aligners? Is it going to be with braces? And so you've got many different options as to how you're going to move the teeth and correct the bite. So you can definitely personalize that. And then there's another kind of big thing to focus on too, which is what does the patient want with regards to their end result? And so, yes, there are certainly standards that you're shooting for, generally speaking, but there are also some subtle details as to what the patient would desire, and it's not necessarily right or wrong. And I'm sure we'll get into that with regards to smile arc and the way that they want their teeth to sort of be presented when they're smiling. And so you have to listen to the patient to be able to provide that.
Why is every smile different? What different factors go into making everyone smile different?
A lot of different things. Earlier in my career, we were sort of fixated on the teeth and the bite. And then as I was sort of wrapping up my residency, what started to become more and more important is kind of this slogan of treating to the face or the soft tissue. And so you've got to factor in the patient's lips, their lip position. You have to factor in their profile, their jawline, how much teeth do they show when they smile. Those are all things that are really important. It's not just a matter of straightening the teeth out and then saying, okay, you're done. And so factoring in exactly where you want the teeth to be to create the best result for that patient's face, because let's face it, we're all different. And then the other thing to kind of think about too is everybody has different size teeth, different shaped teeth, and so you definitely want to factor that in when you're thinking about what the end result's going to look like.
Can you explain why jaw shape would make a difference or tooth structure?
Sure, yeah. Starting with jaw shape, certain jaw lines have a predisposition towards a certain type of bite. So, for example, somebody that has kind of a nice square, strong jaw usually ends up having a deeper bite. And so, you know that you're going to want to use kind of certain mechanics to be able to fix that bite and make sure that it doesn't come back. Conversely, the opposite. Somebody might have a jawline that is sort of more vertical in nature, and they tend to have more of a narrow arch when smiling or an open bite. And so you certainly wouldn't want to apply, like a deep bite, square jaw treatment plan to somebody that has that opposite type of jawline. And then when thinking about tooth structure, one of the things that I'm seeing a lot nowadays are patients that will have smaller lateral incisors. So not the two upper front teeth, but the teeth that are just to the side of that. And so oftentimes we will personalize the care in prepping the patient so that they can have cosmetic work to kind of fill in that space and make those lateral incisors the size that they're supposed to be, which is usually done by the cosmetic dentist after treatment. So those are a couple of good examples of things that we do with regards to sort of personalizing care.
How do you evaluate a patient's smile beyond just how straight the teeth are?
So, first and foremost, you always want to talk to the patient. It's amazing how I'll look at the photos, I'll look at the x ray before meeting the patient. And of course, I always have kind of a preconceived notion as to what I think needs to be done, what I think is best. But you need to make sure that you go in and sit down and spend some time talking with the patient. What is their chief concern? What's bothering them? What do they want to have resolved? So that's definitely kind of a big factor. The other thing that we'll do is I liked it when I'm talking to the patient, I actually like to see what the lip position is when they're talking to me, what the gum line is when they're talking to me and when they're smiling. And so there are a lot of things that you need to factor in when a patient is in motion. It's really easy to look at a static photo and kind of make some decisions and judgments, but it's an entirely different thing to consider what does the patient look like when they're actually, moving and talking and living. So those are a couple of things that we definitely like to look at.
What kind of technology do you use to help create individualized treatment plans?
We have a bunch of technology, and I can certainly talk about that. But interestingly enough, I think that one of the most important things with regards to that is just sort of the experience that I've gained over the years in what to look for with your own human eye. I mean, yes, we have AI, we do dental monitoring, we have 3D printers, we have iTero scanners, yada yada. We've got a lot of things that are very, very high tech. But the one thing that is so crucial is just, having an eye as to kind of what to look for, and then having the experience of knowing what happens when you apply a certain type of treatment plan. And so, not to say that I have all the experience in the world and nobody else has that, but it's taken some time to really understand that when a patient has a request, is it a request that I can actually deliver on, or is it something that's not going to be feasible? There have been many times in my career where I have wanted to try and make the patient happy, and only to learn that those type of movements for that type of jawline or that type of tooth is not going to be feasible. And so, as important as technology is, it's knowing what the limits are with regards to what you can achieve, because the last thing you want to do is kind of over deliver on what you're going to say you're going to do, and then under deliver on the actual results.
Oh, yes, that would be terrible. I'm sure that would,
Right.
it's a recipe for an upset patient for
Right.
sure. Okay, so regarding the 3D technology, digital scanning, how has that changed how you've done treatment over the?
There are a few different ways. One of the big ones is oftentimes now we will scan the patient's teeth so that we can print a set of 3D models. And I'm sure everybody can appreciate it's challenging being able to work in the mouth and with sort of the confined space that you have. But if you can print those 3D models and then be able to hold those in your hand and look at them from different angles and sort of
Hmm.
appreciate the shape and size of the teeth in 3 dimensions, and be able to look at it from different angles. And also, in our case, at least in our office, we place the brackets or the braces on those models before we make a sort of a delivery tray to be able to transfer the braces. So we're able to do things in a way that is much more accurate now. There's also, better and better software that is predicting what smile outcomes will look like. For years and years, what was happening is we would have this software that would sort of generate what the patient could expect their smile to look like when done. And
Mm.
unfortunately, it just wasn't that good. And so we're finally getting to a point where it's getting better and better. And so, yeah, that's what I was referring to. And that, this older software would come up with a smile. The patients would say, I like that. And then it turns out that that's not really realistic as to what it's going to end up looking like. So,
Mm.
fortunately, as time goes on, that has gotten a lot better.
Some people think all braces and aligners are the same. Can you kind of explain how this can make a difference in someone's treatment?
Yeah, definitely not the same, and that's true with regards to kind of durability. It's true with regards to kind of effectiveness. It's true with regards to aesthetics. What do the appliances look like? And so there can be quite a spectrum with regards to kind of the way that these appliances are made, whether it's clear aligners that aren't so clear, or braces that are big and bulky. But even with all that aside, I think that what's sort of really important is that it's less about the product that's being used, because some companies out there will hype that no other brace or no other aligner can create a smile like this. There's something magical about what we have, and that's just simply not true. And I think that's more marketing hype. The way that I would think of, I mean, the two kind of big things that we usually talk about are clear aligners or braces. But the way that I would think about both of those is that they are tools, right? They're tools to use to be able to move teeth. But there isn't anything necessarily special about them that would prevent one brace from being able to move a tooth versus another brace, if I'm being completely frank. I think that there are reasons as to why you would want to use certain braces or certain clear aligners, but it's not the end all be all. And so what's more important is really taking the time to listen to the patient and come up with a treatment plan, and for lack of a better term, sort of use your brain to kind of come up with what that best plan is, and then take the time to figure out which tool is going to be best to do that. I can think of a couple of companies. I'm not going to name them, but they sort of give you this impression that if you don't use this brace, that it's just you're not going to get a great result. And so sometimes that gets a little bit frustrating because it's simply not true.
That makes sense. So how does Cruz Orthodontics make sure each patient gets the exact treatment that fits them best?
So I know I've talked about listening to the patient, but you have to remember that treatment takes a year and a half, sometimes 2 years, and you'll forget these conversations that you have with patients as far as what you promise them that you're going to deliver on. And so, at least in our office, and I'm sure it's true in a lot of other offices, those really key points that are critical to making the patient happy are always front and center on our patient's treatment chart. So when we pull things up on the computer, I have sort of highlighted those really critical things that may be unique to them, because there are basic kind of goals that we're always trying to achieve for all of our patients, but there are going to be a few unique things as well. And so every time we pull the patient's chart up, that is front and center for me, and that is key for me to sort of stay on course and not get off course, and also making sure that it gives me the opportunity to kind of revisit with a conversation with the patient of, these are the things that we're still trying to achieve. Is that correct? Because every once in a while, patients will change their mind as well. And so you'd like to know that.
Really? In the middle of treatment?
Yeah, absolutely. Yep. A good example of that is they think that they're going to want veneers after orthodontic treatment, or an implant, or other kind of specialties that are going to potentially be involved. And then for whatever reason, whether it's cost or it's length of time or the patient's moving, something happens where I think, that's just not going to be in the cards for me. And so, yeah, you want to know those things as soon as possible.
How do you involve the patient in the planning process?
So it comes down to communication. I know I sound like a broken record, but yeah, it's all down to communication. And that communication goes both ways. So it's not me just listening to the patient and taking notes and saying, yeah, absolutely, okay, we can do that. I also have to educate the patient, because sometimes patients come in with unrealistic expectations. There are times where the only way to be able to get the results that they want are that you're going to potentially have to do jaw surgery or extract teeth. And so educating the patient on that, they say, well, I don't want to do that. And they say, okay, we don't have to, but understand what the compromises might end up being if you decide not to do that. And so it also comes down to a lot of education, so that they're sort of empowered to then make a decision based on, everything that I have in my head, I want to kind of put in their head, so that they can then make an excellent decision that's in their best interest.
What's one thing you wish every patient understood about their treatment?
The one thing I would say is that everything that I come up with regards to their customized treatment plan is intentional. And so every once in a while, we'll have patients that want to pick and choose with regards to their treatment plan. And so a good example of that is, elastic wear. A lot of patients have to wear elastics, whether it's with Invisalign or whether it's with braces, and they'll sort of pick and choose whether they want to do that part of it. And so I'll have to explain and educate them, saying, remember, the reason why we do these elastics is to fix the overbite or to fix the underbite. And so oftentimes patients go, oh, I didn't realize that's why I was wearing them. And so I'll tease them and say, well, I'm not having you wear these rubber bands just to be cruel, or just to be an inconvenience.
Yeah.
And so once again, it comes back to education, as far as like, no, every part of this treatment plan has a purpose, has a reason behind it. And so I wish every patient understood that, because sometimes, you can lose a little bit of time because something's not being done that's supposed to be done.
Have you seen how this individualized custom treatment can help with someone's patient's confidence or experience?
Oh, sure. The most common category that helps with regards to confidence is, there's sort of two, but the first one is patients that are going to be then needing restorative work after the orthodontic treatment. And so I can think of a couple patients where they needed lots of veneers and lots of crowns, but their bite was so traumatic that there wasn't room to be able to place those veneers. And even if you did, they'd probably chip or be worn. And so I need to move the teeth into a certain position in order to prepare the patient so that the dentist could do a beautiful job. And those are life changing for those patients. We see lots of patients, and yes, I'd like to think that we provide value for everybody. But there are some patients where it's like, wow, that one is a life changer. And so you can see it. I mean, they're walking tall, they're happy, they're smiling, they're not, putting their hand over their face when they're laughing. And so we've had a number of patients like that. And then, the other situation are those patients that have jaw surgery, particularly patients that have underbites. When they have their underbite corrected, it's a complete life changer. And so normally in those situations, it's multi-specialty. So I'm just kind of one person within that team that's making it happen. But those are definitely really rewarding, gratifying.
All right, if someone is looking for orthodontic care, how do you think someone should go about looking for the best doctor to help them get the smile they want?
Yeah, I mean, I think we can all tell when you're talking to somebody whether or not that person is listening to you or not. And so, what I would say, and I think we've probably all had this experience when you go and see the doctor, or you're seeing somebody where you really have some important information that you want to relay onto them, and you're thinking, man, this has fallen on deaf ears. I don't think they're listening to a word I'm saying. That is such an important aspect. Make sure that whoever you're going and seeing, make sure that they're actually listening to you, because that is kind of foundational as to making sure that you get the treatment that you're looking for.
Great advice, Dr. Cruz. Thanks for coming on for another episode, and we'll talk to you soon.
Take care.